Hello, I'm Michael Kierkustner with MK Sports Massage.
And I'm Staten Rebeck, physical therapist with Revolution Health and Performance. And today we're going to be talking about shoulder pain, specifically as it relates to overhead use injuries in athletes or active individuals. I'll demonstrate some techniques as a physical therapist.
And I'll demonstrate different techniques that massage therapists can use to help prevent shoulder pain and injuries from happening.
All right, as a physical therapist, I will dive into some of the things that I will look at in relation to overhead athletes and overhead use injuries. So the first being range of motion. Michael demonstrated flexion, extension, and abduction. Another motion that you can look at is rotation. So arm elevated, typically to that 90-degree flex position. You can do external rotation and internal rotation. With athletes, sometimes you'll have pain at the very end ranges there on the anterior portion of the shoulder, or very end range there on the posterior portions of the shoulder. I like to look at strength testing. So in the four motions again, you can do flexion, arm out straight, okay, hold down, hold, testing strength there, out to the side, abduction, hold down, good, and then I can also test rotation. With overhead athletes, I like to test it in that overhead position. So up here, okay, rotate back, don't let me push you down, hold it, good. And then internal rotation, don't let me push you up, hold it. All right, good. A lot of times with impingement, you'll have pain in the front of the shoulder, specifically in that supraspinatus muscle. It runs down and crosses just underneath the acromion, that bone you feel right here on the shoulder. So when you're lifting your arm up, if you have pain between 90 and 120 degrees, that is a typical sign of impingement, and we'll go over some techniques you can do to treat that. All right, so here with the client on the table, I can look at several things in relation to overhead shoulder pain. One being passive range of motion. I'll show you a quick exam, what a physical therapist would look at. So you're taking the client into full end ranges of motion. So flexion, okay, going here, asking if they're experiencing any pain. Shoulder impingement, you'll likely have pain more at the end range, okay. It's not bad to stretch out those tissues at the end range. Something that I'll do, incorporate some treatment along with the assessment, because you're just stretching those tissues. It's nothing really that's going to be aggravating to the client. Abduction, okay, coming out to the side. With shoulder impingement, the most common area of pain is between 90 and 120 degrees of pain, okay. That's narrowing the joint space to where the acromion may be impinging upon that supraspinatus tendon. Okay, that's more of just telling me that are we dealing with impingement, are we dealing with something else? If you're experiencing pain more at the end range here, okay, even on the front of the shoulder, it could be an AC joint related problem, okay, the acromioclavicular joint. More just diagnostic things that physical therapists will be looking at. A lot of the treatment is similar. Rotation-wise, okay, you can do this in seated or standing, but you're taking them back into a full external rotation position. You want their humerus to be supported, okay. If they have pain there at the end range, you're maybe thinking more of a anterior head of the biceps, maybe even a pec tightness, imbalance causing some shoulder pain. Internal rotation, just the opposite here. Okay, rotating down. I'm stabilizing the humerus here with my hand in order to prevent joint range of motion. Okay. Assessing for infield there, hard, pain, firm infield. If you're having pain there, oftentimes it's the back of the shoulder, maybe a rotator cuff tightness issue. Okay. So I can stretch out here in the rotation range of motions. Here Michael's a little bit tighter into internal rotation, so that can be something that we'll work on. And you can do several different joint mobilizations as well if it's a joint restriction that you're dealing with. Flexion, okay, I can take them into flexion here. Stabilizing just on the left side of that shoulder on the humerus, pushing down, Okay, trying to gain some more rotation and sliding motion of that humerus to gain range of motion there. Abduction, again, just on the outer part of that shoulder joint, stabilizing, pushing forward. Okay. Research is mixed, but oftentimes you'll want to perform a joint mobilization, multiple repetitions for about 30 to 60 seconds at a time. Alright, so another thing that I'll look at is muscular tightness in individuals that have overhead shoulder pain. Oftentimes they'll experience tightness on the posterior shoulder, so we're talking muscles like the infraspinatus on the back of that shoulder blade, teres minor, rhomboids, lats, serratus anterior. All of those muscles can contribute to tightness in the shoulder, which you may experience with overhead pain. So techniques here to maybe relieve some of that tightness are just trigger point release, okay, using my thumb, providing some pressure, and then my opposite hand to really push down and assess for some of those points of tenderness. Okay. You're asking the client if they're experiencing an increase in pain. It should be a good hurt feeling, so firm but tolerable pressure. And then you're looking for those almost rope-like knots in the shoulder. You can hold pressure, or you can slowly glide over some of those muscles back and forth. And you can kind of see Michael's areas of tightness, okay, where it moves over rather quickly. So I'm holding, providing some pressure, or I'm rolling slowly back and forth just to help decrease some of that muscular tightness. You can also look at muscles such as the upper trap, common one that's tight in a lot of individuals, especially people that are working overhead in long periods of time, or people that are internally rotated, working desk jobs often. So there's a squeeze technique here, again, assessing for trigger points, muscular tightness, just kind of pinching, seeing if I can find any areas of tightness, holding there. Okay, or again, you can kind of slowly roll over some of those areas. So one technique that you can utilize in order to gain range of motion is a contract relax technique. So while the client is here on their back, if they're having trouble getting into this flexion range of motion, what you can do is take them to their end range. So let's say Michael has tightness, can't really push past there much. I'm going to have him push his arm into my hand for a period of 5 to 10 seconds. Okay, go 1, 2, 3, 4, 5, and then relax. Okay, and then I can stretch that a little bit further. The thought process here is the muscles that you're intending to stretch. So here maybe the lat, okay, you're actually contracting those, causing the muscle to tense up some, and then the relaxing may be able to further your stretch. Okay, you want to contract for a period of 5 to 15 seconds, and then you can stretch anywhere from 5 to 30 seconds. You can do that for all different ranges of motion. So rotation is another common one, specifically with pitchers, volleyball players, but they may really have some tightness into the internal rotation range of motion. Okay, that posterior shoulder is restricting them. So what I'll have Michael do here is kind of rotate your arm down into my hand, pushing down, push down, hold, and relax. Okay, and I can stretch that a little bit further. You can do this into external rotation as well. Oftentimes with pitchers, volleyball players, they have a ton of external rotation, so you don't really want to stretch that too much. You're working more stability into the external rotation range of motion, and then you're stretching into internal rotation, which is often where some of their limitations lie. The last thing that I typically look at in people with overhead shoulder pain is the strength of some of these more underutilized muscles. So your rotator cuff, lower trap, rhomboids, and how they function in different positions, and compare that from side to side. So a couple tests here for Michael. Let's say he's dealing with some left shoulder pain. I will first take him into an extension position. Okay, have him hold there. Don't let me push your arm down. Hold it. Okay, testing strength there, comparing side to side. Okay, abduction position, horizontal abduction. Okay, holding there, going up. So hold the arm up. Don't let me push it down. Okay, relax. Sometimes you may have some weakness in the middle trap, rhomboid area, demonstrating imbalance from side to side. Okay, lower trap here, I'll have him go into a Y position, thumb up towards the ceiling, raise your arm. Okay, you may just have some muscular tightness or joint restrictions preventing the client from getting into that motion. So that's something that you can address. Otherwise, hold, don't let me push you down. Okay, relax. If you were to experience weakness, let's say he broke there and could not hold that position, okay, you're dealing with more of a lower trap issue that may be causing your scapula to move differently from side to side, and that may be causing stress at different areas of the joint, so you need to really address some of these muscle restrictions. Go ahead and relax. Lastly, you can do a rotation. Okay, so I'm here, hold that arm up there, okay? Don't let me push your hand down, hold. Okay, relax. External rotation is often a motion of weakness. You can relax there. So if they're dealing with an imbalance from side to side and you see weakness with that rotation range of motion, you can prescribe exercises to help strengthen.
All right, so one of the things I like to do to help with shoulder pain is target two muscles that might cause winging of the scapula. So our serratus anterior and our pec minor muscles. So pec minor runs from that coracoid process down to the ribs, and serratus anterior is in that armpit area here. So what you can do for pec minor is some circular friction or even stripping techniques. And our goal here is to get more blood flow into that area and have that tight muscle, that tight pec minor muscle that's pulling that scapula forward. We want to release that to help that scapula drop posteriorly. After you get done with that pec minor muscle, I like to come down to our serratus anterior muscle. It goes in between the anterior portion of the scapula and the ribs here in the armpit area. Typically what I'll do, you can do two techniques. You can use your fingers or even use your thumb. You gotta be careful when you use your thumb, just because overuse, you can definitely injure that. But typically you're gonna pin, this is kind of a pin and stretch, where first of all I will pin that muscle down, and then I will passively move that shoulder into a horizontal adduction across the body, and nice and slow, and then you can pin it on the way back as well. After you do that about 2 or 3 times passively, you're going to have them actively do this motion. So this is where you can even get into better body mechanics. You can use both hands to pin that, and nice and slow, reaching across the body and coming back. And I usually count down from about 7. We want them to take about 7 seconds to get across the body. So that's that. And I want you to slowly move it. We're going to go 6, 5, 4, 3, 2, 1, and relax. Back down. This is going to help give that serratus anterior muscle a nice release to help from that anterior shoulder movement. So another technique I like to do for the shoulder is where we can massage their muscles under our hands. So a lot of times as massage therapists, we think that we need to move our hands to do the massage, but a lot of times we can just allow our hands to compress that muscle, press that anterior deltoid, moving down into the biceps. And what we're going to do is take that shoulder into a internal rotation here and allow those muscles to glide underneath that pressure from my hand on the shoulder here. Then you can kind of grip that tissue, come back, and work that posterior side, moving down the arm to target all fibers along that muscle strand, all different fibers of that muscle strand. How does that feel, Staten?
That's great.
And speed, you don't need to be fast here. The importance here is to use a low grip massage lotion so that you can actually target, or so you can actually have a grip when you're moving through. You don't want to be slipping and sliding like you would. You wouldn't use oil for this technique because you'd slip right off. You want to go nice and slow through that motion. This last technique requires us to get a little bit closer to the client. What we're going to do is sit on the table next to the client, have their arm above our thigh, and what we're targeting here is that upper shoulder and wanting to loosen up the tight muscles that are keeping the shoulder, keeping the humerus in that glenohumeral joint. So after you've done various massage on the back and the arm, you can have them lie face down, and typically you can grab the elbow and the wrist here and kind of pull down, using that thigh as leverage to help pull that humerus off of the shoulder, and then let it relax back towards the body, back towards that glenohumeral joint. Again, come back down, pulling, stretching that shoulder. And you can even, at this position, you can even get some pretty good leverage doing some deep tissue work on their upper traps, rhomboids, and other muscles that are affecting the shoulder.